My name is Talitha Smady-McCloskey. I am the Interim Manager of Communications and Public Relations with the CRNS, and I'm joined today by Barb McDonald, RN and Nursing Advisor with the CRNS, to chat about the new RN AAP practice standards that came into effect on November 1st of 2022. Barb and her team, along with some fantastic outside consultation, have worked diligently to update these standards for registered nurses with additional authorized practice. So I'm looking forward to learning more about what's been updated, what's different, and what's important to note. So Barb, let's start with my first burning question. Why new standards at all?
Yeah, thanks, Talitha, and thanks for the introduction. The new standards are really updated standards. So the RN with additional authorized practice standards have been in effect for a number of years, and it was time for the update. So it was really a sequential thing. There's nothing that is changed about RN AAP practice. So it builds upon the RN practice standards that have been updated in the meantime, and we go from there.
Fantastic. Obviously great to know that things are just being continuously updated as practice evolves and changes. What specific new additions can RN AAPs expect to see?
I would say that nothing is new necessarily in terms of practice. However, the way that the RN with the AAP practice standards are laid out essentially highlight which particular standards have additional indicators for the RN AAP. So we'll take a look into that document in a few minutes, but essentially it really just emphasizes the role of the RN AAP consistent with the legislation and what the scope of practice is for the RN AAP within the document. So this is a document that essentially has been through a rigorous process of approval from the council approval to membership approval in May, and also through the SAS ministry to be in effect now November 1st, 2022.
Very rigorous indeed. So from my understanding, the primary difference then between RN and RN AAP practice standards is that additional added responsibility and designation permit to prescribe medications within the CDTs, if that's correct, if I understand that correctly. Perfect. So is there a resource within the RN AAP practice standards which describes the responsibilities regarding prescribing?
Yes, absolutely. The bylaw specifically that outlines RNs with additional authorized practice, that all the scope of practice within the bylaw is indicated within the standard itself, the practice standard. So it's a little bit of an all-in-one one-stop shop, so you can see the scope of practice for the RN AAP and the indicators for practice as well.
Perfect. Very nicely laid out and easily accessible, it sounds like. So
yeah, I would emphasize that that RN AAPs are in the RN category and can treat limited common medical disorders consistent with the 58 clinical decision tools, which are created and maintained by the CRNS. So on our webpage, which we'll also show in a minute or so, all of the 58 clinical decision tools have been updated in 2022, as well as this practice standard. So it's all in one place on our website.
Fantastic. Thank you for clarifying that and describing that for our folks watching. So because RN AAPs are within the RN category of practice, as opposed to the NP category or just a category within themselves, how do these practice standards work with the RN practice standards?
Yeah, great question. So the RN practice standards apply to all registrants with the CRNS. So they lay the foundation for our practice along with the entry-level competencies and the CNA Code of Ethics. So those three foundational documents apply to all registrants at the CRNS, and the RN AAP practice standards build upon those standards to include the indicators that are specific to RN AAP practice.
Fantastic. Thank you again for that clarification. So I know that for the CRNS, we have RN specialty practices that can allow the authority to perhaps prescribe a medication or whatever it may be as it's laid out in the RNSP. Can you explain the difference between the RN AAP roles and where RN specialty practices come in and perhaps how they relate?
Yeah, so one verb that I would pick up on in your description is the word prescribe. So registered nurses in the RN category cannot prescribe at this point in time, according to our bylaws. They can provide medications, they can provide care within the RN specialty practices framework. So I would certainly guide people to that guideline. And within that context, they can certainly optimize registered nurse practice, and specifically for either a client-specific order or a directive for a client population, which is where a directive would apply to having registered nurse practice be optimized. So that applies to all registered nurses in the RN category. And RN AAPs would be no exception to that. So their practice would include some RN specialty practices, and then they would have this capacity to prescribe and treat for limited common medical disorders that are contained in the 58 clinical decision tools. So in the RN category, the only ones at this point who can prescribe specifically are RNs with additional authorized practice. And then, of course, our NPs in the NP category can prescribe as well. And so there is also another document called the Prescribing Guideline that the CRNS has created for any registrants who can prescribe, and the principles of safe prescribing are included in that guideline.
Fantastic. Thank you for reviewing that. So I think it'd probably be good then to review those different categories that you had talked about and where RN AAPs kind of lie, and then also perhaps review the practice standards, if you're okay with that.
Yeah, I think that sounds good. And we've put a slide together that can help create a pictorial or a diagram essentially that highlights those the categories to make it just a little bit easier to understand overall. So essentially, we practice under the legislation, which is the Registered Nurses Act 1988. And so all of our registrants practice under that legislation. And it's a beautiful piece of legislation that truly enables practice to be optimized. And where it comes to life then is in the bylaws that are created essentially. So those bylaws describe how the Act comes to life and how practice can occur in Saskatchewan. And those bylaws are updated annually and go through a rigorous process as well. So within the bylaws, the categories and who can do what within the legislation are described very clearly. So we have the RN category, which would apply to all CRNS registrants. And then we also have the NP category. So what happens is that anyone practicing within these two categories adheres to the RN practice standards and also the Canadian Nurses Association Code of Ethics. So they apply to all registrants. And then also what happens then is that we have academic preparation, and that is also guided by our legislation. And then once there's entry to practice, then registered nurses have entry-level competencies that are described really clearly, and everyone once again adheres to them. And you'll recall that there are 9 roles, I believe it's nine roles that the RN is practicing within. So those entry-level competencies are the entry to practice. And then one of the things that we have specific to Saskatchewan is the RN specialty practices model. And it really supports the best possible practice in the interest of the public with 4 key components. And I really would invite you to review those practices, and they apply to all RNs in the RN category. For those who are becoming NPs, again, through the legislation, we have the academic preparation that is regulated, and there are entry-level competencies and specific NP practice standards that apply to NPs that show that continuum to become an NP under our legislation. So there are approximately 12,000 nurses in Saskatchewan, registered nurses, and within our registrants, there are about approximately 250 who are NPs. So then we have this additional designation within the RN category. So it's an important distinction. It's a designation within the RN category where it's registered nurses with additional authorized practice. And it's been in effect for, I want to say somewhere between, I think it's 2016. So what is that? 6 years when it was first established. And as we were saying, RNs with additional authorized practice have practice standards that we're going to review in a moment that have just been updated. There are fewer than 120 RN AAPs exclusively in the North. And they can prescribe and treat for limited common medical disorders. So you will see that RN specialty practices, as we discussed a little bit earlier, will apply to RN AAPs, but there's a distinction about when they are acting within the RN AAP role, treating only the 58 clinical decision, according to the clinical decision tools. But within their practice, of course, they'll be operating as registered nurses within RN specialty practices as well. So for example, some of the emergency sorts of things that may apply to them in their practice area. If there's any sort of question or confusion around this, we're happy to take questions, and this is just meant to be sort of a high level overview. So we'll dive right into the RN with additional authorized practice standards, and you'll find them on our website, crns.ca, and we'll take you through to how to find them. Under the menu, you'll see practice, and so we'll click on practice, and then if you scroll down, you'll find nursing practice resources, fourth in line. And then when you come to this page, scroll down and you'll see, first of all, on the left, registered nurse resources that apply to everyone. There's practitioner resources on the right. And then down lower, you'll see RN AAP resources. And if you click on read more here, you'll see that the 58 clinical decision tools are at the bottom of the page. And those have just been recently updated, all 58 of them in 2022. With the date of approval on them. So it's an evergreening process. And they describe specifically what treatments the RN AAP can prescribe and the context for the practice, when to refer, when to, when to call in additional support when it's beyond their capacity and so on. So that means that they can prescribe for those particular limited common medical disorders. And then at the top, the document that we're going to just click on and highlight, this one that's now effective November 1st, is the RN with additional authorized practice standards. So the new branding, nice clean look, the title, and we're just going to really fly through it, but you'll see it's effective November 1st. The introduction, it gives a high-level overview about there are going to be specific indicators for RN AAP practice, but to remember that, first of all, RN AAPs practice within and must comply with the RN practice standards, the RN entry-level competencies, and the CNA Code of Ethics. So there are direct links within the document to those foundational documents. And then we begin with a background about practice standards, the RN practice standards, as a reminder about what sort of weight they hold and that we all must comply with those standards. There are 5 standards within the RN practice standards, and within the RN AAP for the indicators, there will only be 2 standards that are impacted for RN AAP practice, and they are professional responsibility and accountability and knowledge-based practice. So before we dive into the indicators, we do talk about what is an RN AAP, and you'll see that there are direct quotes from the bylaws to describe the scope of the RN AAP. So they can treat limited common medical disorders according to specific clinical decision tools, and it's enabled through the Act, just as described and emphasized probably 3 times already. So then we'll just go down to RN AAP practice means that they're treating limited common medical disorders, which are described here. And what is a clinical decision tool, and what are the format of the clinical decision tools? In the practice environment, it's described as well, and always keeping the client at the center and making decisions that are in the interest of the client. Means that it's possible to treat within these clinical decision tools, but it's also always keeping the context and the client's needs at the center. Under professional responsibility and accountability, you'll see the indicators that are specific to RN AAP practice. So they build on the indicators from the standard 1 in the RN practice standard and describe exactly what needs to occur. And along with standard 2 knowledge-based practice, there are additional indicators. And then as you scroll down, you'll see that standards 3, 4, and 5 have no additional indicators, and it follows up with the references for this document with no appendices. So it has really been a shortened document. Some of the appendices now, as I mentioned before, have been made into a practice guideline for prescribing. So we think it's a rather clean document and easy to read and understand, and it provides clear regulatory direction for RN AAP practice.
Thank you so much for going through that, Barb. It truly is a nice, condensed, rich document that provides all the direction and everything required for RN AAPs, easy to follow. So I appreciate you and your team and all the folks that consulted on it and made it come to life. Do you have any final thoughts that you would like to share about the RN AAP practice standards?
I think that it's just been a really great team process and lots of consultation to make sure we have it right and to truly make it a document that is helpful for scope of practice and to provide that direction for employers, RN AAPs, and all registrants really, and for the public, so that they can understand what the role of the RN AAP is. And it's a celebration in a sense because it's the first RNs in the RN category in Saskatchewan to be able to prescribe. So it provides a lot of information and direction for the future as well. So I'd just like to thank the whole team for making this document happen. There have been some great insights and discussions. And if you have any questions, coming to us, practice advice at crns.ca is really a great place to go and offer your comments. Or if you see something in practice where, that CDT seems as though that might not be consistent, please let us know, because practice changes all the time. There's so many new different ways of doing that. And always remember that you're the expert in your practice and that we are here to support you.
Fantastic, Barb. Thank you so much.
Thanks, Talitha. Take care, everyone.
Thanks.